Hello, I'm going to give a persuasive speech and I'm going to try to get you to become an organ donor. How many of you want to say that you have saved a life, but you don't know how, or whatever that may be? But if you want to become an organ donor, you can save a life and do that. It's a selfless way to give back to others, and you don't even have to do anything. But if you want to make a huge difference in their life, you can just become an organ donor. Unfortunately, the number of patients waiting for organs far exceeds the number of people that have registered to become one. So patients are forced to wait months or years, and a lot of them die before they even have a match to get their organ transplanted. There are many stigmas related to organ donation, but most of them are false. And in order to become well informed about being an organ donor, then you must know what an organ donation is and how it works, as well as how you can become an organ donor and what organs or tissues you can donate. To become an organ donor after death, it's an important decision for yourself, but also it can help save the life of others. What is organ donation and how it works? Well, organ donation takes healthy organs from your body and transplants them into another. You can donate kidneys, liver, heart, pancreas, bones, bone marrow, or the cornea of your eye, as well as your intestines or your lungs. And you can donate these organs if you are healthy enough to, and if they're so good in your body. Organ donation usually occurs for patients with kidney failure, heart disease, lung disease, and cirrhosis of the liver. For patients that need a kidney or a liver, a living donator can donate their organs, but if you are in need of a heart or a lung or a pancreas or a cornea, the organ needs to come from a deceased person. A transplant is usually the last course of action that they want to take for a patient, but if the patient is willing and able and is in good health, it could be an option. You can go to Discovery Health to find some of these facts. And if the patient consents to an organ transplant, then doctors put the patient's name on a list for the United Network of Organ Sharing, and they can wait to try to become an organ donor and find matches for them. UNOS, which is the United Network for Organ Sharing, has a database where all the patients wait for their information on all the organ transplant centers from around the country, and the board of directors establishes policies to decide who will get the organs, and acceptable donors are those who are brain dead or are still on life support. A match is made when both the donor and the recipient have the same blood and tissue type, and also how long a patient waits for an organ is a big factor when they choose the patient. My other argument is arguments against organ donation and myths about it. And people of all ages and backgrounds can become organ donors. And if you're under 18, you have to get consent from a parent, but it doesn't matter the age you are. And there are many myths about becoming an organ donor, but you can find a few of them at themayoclinic.com. And a few of them are, if you agree to donate your organs, if I agree to donate my organs, the hospital won't work as hard to save my life. Well, when you go to a hospital for treatment, the doctor focuses on saving your life, not somebody else's. So the doctor in charge of your care has nothing to do with the transplant. Will organ donation be against my religion? Well, organ donation is consistent with most of the beliefs of many religions. And if you're unsure of your position on that subject, then you can just go to organdonor.com, which has a list of the many religious views on organ donating. An open casket funeral isn't an option for an organ donor. Well, the donor's body is fully clothed, and when they do the surgery, then they cover up all the scars and tissue so it's not available. And For bone donors, the rod is inserted where the bone was removed, and for skin donors, the skin donation is taken from the person's back. And so the areas will be clothed and you will not see them in the casket. Are you too old to donate? Well, you can donate at any age. There's no cutoff age for donating your organs. Many people that are still in their 60s, 70s, and 80s still donate their organs if they are able, and they have had many very successful transplants because of that. If you decide that you want to, it's based on age, but not necessarily, it's based on your medical criteria, not just necessarily your age. So you can do it at any age you want. Maybe I won't be dead when they sign the birth certificate. Well, people who are organ donors are given more tests to determine if the patient is actually dead than they would to those who are not organ donors. So they check you if you are an organ donor, and they make sure that you really are dead. If you want to become an organ donor, then there are benefits to it. Register within your state by going to organdonor.gov and registering online according to the state you are in. All you have to do is enter your name and basic information, and also the organs that you are willing to donate. You can also put on your birth certificate. On my birth certificate, I do have that I am an organ donor and I will donate my organs. If you want, you can carry a card with you, and it designates your decision on your driver's license, which I have right here. So it shows that I'm an organ donor on here. And the benefits that come along with organ donating are you get the satisfaction of being able to know that you saved someone else's life and you are helping someone else. I never really considered becoming an organ donor for a while because I never really knew what it was, but now that I do know, I have changed it on my license, and I am willing to I'm willing to help someone out, and I am an organ donor. And if you aren't sure about it, then you can look into it, and you can register always to be one, and it's a great way to save other people's life because we are in need of organ donors in the U.S. Thank you.